So I'd like to know whether lockdown is the only alternative in countries like Spain or France or Belgium or Italy at the moment. Or would a wider use of tests be possible to avoid this?
So, to answer the first question, the rapid tests are now coming to the market. We have today put forward a testing strategy, and we will work more intensively and come out in a couple of weeks with a more detailed concept what the rapid tests are concerned. The rapid tests have a big advantage. They are fast, they are cheap, and therefore they can fit into a certain hole, because when you get the result is also a crucial one. Of course, the gold standard are the PCR tests, but the rapid antigen tests can complement very well. They are not as reliable as the PCR tests, because they are not as good as the PCR tests to detect an infection when there are no symptoms and there is a low virus load. But they have their advantages, what speed is concerned and what mass testing is concerned in a population where you have a high level of infection, or in a situation, environment where you have a high level of infection. So it's not only one test. There are different ones. What we also are going to do is evaluate the different tests so that we have a better idea what the quality is of the different ones, and can give this advice to the member states.
Thank you. Je passe maintenant à Philippe. Oh, sorry. Professor Piot, do you want to add something?
Oui, merci beaucoup.
Thank you very much, Mrs. Pastor. When I said individual responsibility, I mean that's not the only thing. All I'm saying is that this requires action at all levels, European and national and individual level. Is lockdown the only option? Well, the reply is it depends on the extent of the situation and the spread of the virus. If we see a spike in coronavirus epidemic early, if we anticipate it, then we can limit lockdown to a particular area, or as we've seen in some countries, to certain slaughterhouses. We can pinpoint it and carry out test and trace, and therefore quarantine, which is very targeted. But once there is a spread on a large scale throughout the community, it's much more difficult to do that. There are countries, though, who may opt for tracing, large-scale tracing, but you'd have to see how frequently they're going to test. Is it every week, every 3 days? Those are questions which are still open. And you shouldn't forget that what's acceptable in one country is not, like China, is not necessarily acceptable for citizens here. But I think greater deployment of tests, as the President said, with the new tests, I think that should be part of the panoply of part of the package. But in many countries, the situation is such currently, with a widespread infection within throughout the community, that a degree of lockdown is certainly necessary in order to suppress the virus and save lives.